We just have a few closing remarks for today's session, but not closing for our learning. Want to welcome you back after just really exciting conversations in all the breakout rooms. I can't wait for us to share our thoughts and what we've learned and recommendations tomorrow. But I just wanted to take a moment and thank all of our speakers, our facilitators, the staff that have made today possible, and I just hope you know how much we truly appreciate you being involved in today's session, because it truly does take this diversity of thought and experience to move us forward. It is all about relationships, and I hope that we're making good foundations and moving forward together. I feel like the discussion in this workshop has really reflected the principles of the forum. The P factor was brought up today, and I think it was almost a relief that we had an intentional, active conversation. So that's one of our guiding principles, to be person-centered. The other guiding principles include engagement of students, and I feel like today we were students. We were participating in continuing professional development, learning more about continuums of learning and how it can impact healthcare. And finally, I hope that we all learned from and with each other, and from outside the United States and within the United States, so that we can continue to contribute to the conversation. So now, Co-Chair Ron has a few closing remarks, and we'll get our marching orders.
Thank you, Holly, and let me just second the great appreciation for everything we've done today. Interprofessional learning, we've learned with each other over this period of time. So just a couple of final reflections that I have. You know, when I remarked that the 2010 report stated that demonstrating the value or business case for CPD is largely unexplored at present. We can now say that is no longer true. So we have accomplished something really important to reach back and then to continue this conversation, hopefully going forward from here. And the second observation I'd like to make is, you know, a lot of things happen at these conferences. Sometimes they happen inside the room, sometimes outside the room. And there was an incredible serendipity that I just wanted to bring to your attention. And it relates to the patient perspective and the very powerful presentation we heard about the really critical role that the patient perspective plays in CPD. And I don't know if you saw, but when he left the room, Kate Regnier, who is on the ACCME Accreditation Council, ran after him, and she said that, you know, in our new accreditation with commendation, accreditation criteria explicitly states that if you want accreditation with commendation, one of the 16 things you can do is patient public representatives are engaged in the planning and delivery of CME, right? And I'll just read this little blurb that explains that. Accredited CME is enhanced when it incorporates the interests of the people who are served by the healthcare system. This can be achieved when patients and/or public representatives are engaged in the planning and delivery of CME. This criterion recognizes providers that incorporate patient and/or public representatives as planners and faculty in the accredited program. So a little bit of serendipity. He said, I had no idea. He was completely surprised and looks forward to helping ACCME because they are having, Kate said they're having difficulty identifying patient advocates and patient representatives. So a little bit of serendipity we're all part of. We can say, you know, we saw it here, that how critically important the patient perspective is in our work in CPD. So with that, I just want to close and say, yes.
I just wanted to add a statement that it's not just in continuing professional development that this is happening. It's not just in CPD that the patient involvement and patient representative involvement is happening. It's happening in all the accreditation systems. The ACGME, just to take one other example, now has patient representatives on all the residency review committees as well as the board of the organization. So this is a general phenomenon, I think.
Right. Thank you. Anything else? Any other comments or reflections that people would like to add at this point? Okay, wonderful day. Breakfast is at 7:30 tomorrow morning. We have a fantastic panel that Malcolm will be chairing with some of our accreditors and credentialing folks to think about how everything can get aligned and what some of the options and possibilities are therein. So, and then secondly, of course, hearing the fruits of your conversations and about exploring the business case for your investing entity. So have a good night. We'll see you in the morning.